If you're worried about having to get surgery or rely on injections due to your knee pain, this video is for you. If you're a CrossFitter or an active adult that has been modifying or pushing through knee pain during their workouts or not working out at all because of that knee pain, then I want you to pay close attention. In my last two videos, I discussed why it's important to manage mobility and strength from a knee rehab perspective in regards to knee osteoarthritis, but those same principles apply across the spectrum of a lot of different injuries for knee pain. And in this video, I'm going to talk about a technique that's used when people have gone through those processes and are still struggling. Someone that can't tolerate doing the loading exercises to strengthen their knee because it's a little too sensitive or it leaves them in too much pain afterwards. This technique is called blood flow restriction training, and it allows us to make strength changes with significantly less load, so we're putting less weight on the joint and not causing as much irritation. We're gonna go into that in a second, but before we do, I wanna talk to you about the two major reasons as to why people tend to fail those other methods first, so that we can discuss where you might be. Oftentimes, I see people say that they tried PT and they've done rehab and they haven't had any success. This is usually due to not seeing someone that is pushing them enough. They're not making enough strength gains and they're not progressively overloading those exercises over time. They may be doing some simple exercises on a table that they're never getting off of and not truly loading that knee. And second is because they are just trying to piece together exercises on their own from Instagram or YouTube, and they haven't actually sought out professional help, which is kind of like trying to drive with a blindfold. So we're gonna dive into those two reasons a little bit more, and then we're gonna discuss how blood flow restriction training can be helpful if you're one of those people that truly has gone through that right way to do those first two methods and are still struggling. This is why your knee pain is not getting better. I see people all of the time who have said they've gone to physical therapy and this is all that they've done. Doing clamshells on a table, doing some simple bridges while pushing out into the band, doing some straight leg raises, some leg lifts on the side, and wondering why they still have knee pain. Maybe you've tried foam rolling your IT band, or even your quads, or even directly on your knee itself, and you're wondering why your knee still hurts. While foam rolling can have its place and mobility is very important, I have a whole video on this as to why mobility is important for knee pain. It's not enough by itself to just work on foam rolling, mobility, or even light band exercises. What we need to do for the knee is make sure all of the muscles surrounding that knee joint are as strong as possible. Exercises with the band are sometimes good places to start if people can't tolerate doing those other exercises that are directly loading the joint. But an even better thing to do is going to be to directly load the joint in a way that doesn't cause as much pain, which we're going to dive into later in this video. When we're relying on just light little bands or body weight exercises like sit to stands through partial range of motion or even through full range of motion, we're often not targeting those muscles enough to truly make them stronger. Or if we are, we're just kind of leaving them at that same level where people plateau and they're not improving their strength. That's why we need to have a personalized plan to make sure that you are actually progressively overloading your strength, which we talk about in our video 2 on the series as to how to manage knee arthritis and knee pain using mobility and strength exercises. If you've gone through both of those processes and are still struggling, that's where blood flow restriction training can come into play. Before we dive into that, we're going to talk about the opposite direction, which is overloading the knee. This is where you'll see people continuing to do jumping, running, high explosive exercises, or heavy weightlifting, despite the fact that they have pain in their knees. You'll see them putting knee wraps on, wrapping voodoo floss around their knee, and lifting heavy despite the pain, and then they're aching for days afterwards. Yes, you might be getting stronger, but you're overloading the joint to the point where it is not handling that stress well and then causing further inflammation and a lack of ability to fully use that joint in a way that is functional. This is also going to cause decline and further pain. So we need to find a middle road where we're loading that joint in the correct way, and more importantly, loading the muscles surrounding that joint in a way that's going to get them stronger, but not irritate the joint itself. Avoid swelling, avoid buckling of that knee, and avoid sharp pain that's occurring during or after exercise. So how do we strengthen the leg when it is too painful to load it? With blood flow restriction training, what we do is we put a cuff around the leg, get it nice and tight, and attach it to a device that is meant to find a personalized pressure for you. So what it's going to do is partially limit how much blood is going into the leg and occlude the blood from leaving the leg during exercise. Once we have this device set up, we are going to go ahead and allow it to inflate to that number that I had found before. So this is not like a tourniquet that's being used during surgery. It's not 100% cutting off your blood flow, and we're only leaving it on for a few minutes at a time. This is only a light pressure right now, and we never fully occlude that blood into that leg. So you're not feeling numbness or tingling, and we're certainly not getting any inability to feel the leg during the exercise. Once this is inflated, what we do is we go ahead and unhook the device here, and then we do exercise with it on. That makes the exercise significantly more challenging for those muscles because they're not getting as much nutrients going down into that muscle as it's getting tired. And as the muscle uses the energy in our bloodstream and releases it into the bloodstream, it is not able to leave the leg. So it creates an environment around the muscle cells that is making it much more fatigued than if this was not here, almost tricking those muscles into thinking they did heavier work than they actually did. And I say that lightly because we are actually stressing the muscles as if they were doing more challenging work, so they are getting that same mechanical stress. So once we have that cuff inflated on the affected leg, there are a multitude of exercises that we can do. Simply just doing squats, shifting weight a little bit over that affected leg. Doing this with weight will fatigue the leg that has the cuff on it much more. So we need to make sure that we're not shifting away from that side and that we're really keeping weight on the affected leg a little bit more. That is going to allow us to do a lot less load with a squat that might otherwise cause pain through that knee. We can also do things like Bulgarian split squats with the cuff on, where otherwise to really get good quad strength, we might be doing much more weight. And just because I have this cuff on, it allows me to fatigue that quad and those thigh muscles much faster than if I did not. We still want to get full depth, full range of motion. We don't want to rush through those sets, and we're going to do a higher volume. So typically if we're doing strength training for these types of exercises, we might be hitting somewhere in the 5 to 8 range. With this on, we're going to find a weight where 15 reps is challenging for 4 sets and only having 30 seconds of rest in between. So we're really fatiguing that quadricep and thigh muscle pretty quickly and then pushing through that fatigue, which is going to force these muscles to really work hard and have a lot of mechanical tension through them as they're in a fatigued state, as the byproducts from all of that energy use in the muscle are not allowing to get recycled. They're not leaving that leg because the cuff is on while it's inflated. So as we do this, we typically are only doing this supervised, not recommending that someone go out and try this on their own without supervision, because if you do too much too soon, that's where you can get muscle injury and lead to more serious problems. But if you gradually ramp up to loads that are tolerable and you are doing the appropriate activity that is not causing knee pain, this can be really, really beneficial. And we can even do a higher frequency of training, sometimes up to 5 times a week with BFR versus traditional strength training. So we can really make a lot of great progress for someone that is dealing with that knee pain that otherwise would only be able to tolerate light load anyway. So this is a great option for people that have not been able to tolerate other exercises. Now, those exercises for some people might even be too intense. So we can do seated knee extensions with ankle weights or on a knee extension machine or with bands, or even more body weight exercises to start and gradually ramp up to exercises like these. So we're not always starting in the same place, which is why it's important to have a trained clinician guide you through blood flow restriction training if you're using it to manage knee pain. If you found this video helpful, I want you to subscribe to our channel. We come out with new videos all the time on how to manage your knee pain. And if you have any questions, feel free to comment below. I also want you to go ahead and tag someone that might find this beneficial if they've been struggling with knee pain and felt like they've tried everything so far. If you're interested in blood flow restriction training and you think this might be a good option for you, I want you to go ahead and apply below with the link in the video description for our personalized blood flow restriction training plan. You can apply for a free discovery call there and we'll get you set up and see if it's the right fit for you.